Hi, welcome to 𝐂𝐨𝐷 University. Today we will be talking about the ill effects of tobacco as the World No Tobacco Day is approaching. WHO in 1988 passed a resolution regarding World No Tobacco Day, and since then it is being celebrated on 31st of May every year. It gives us an opportunity to learn about the ill effects of tobacco and the importance of various tobacco cessation activities. It is our privilege to have Dr. Charu Khurana from the Faculty of Dental Sciences, who is working as a dental officer in the tobacco cessation clinic as well. Welcome, ma'am. Ma'am, what is the burden of tobacco usage in our country?
Tobacco kills 8 million people every year, where 7 million deaths because of direct tobacco use, around 1.2 million deaths are because of second-hand smoke. It is the leading preventable cause of death in the world. Tobacco, being a common risk factor, is responsible for many non-communicable diseases like heart disease, diabetes and others. And also it accounts for many deaths among men and women because of oral cancer as a causative factor.
That are a lot of deaths you are talking about, ma'am.
Yes, of course.
Despite tobacco being such a menace, why do you think people are not giving up this habit?
Consuming tobacco is an addiction. Nicotine is a pharmacological substance that stimulates release of dopamine in the brain and leading to the feelings of pleasantness and calmness and self-reward. So it becomes difficult for the patient to just give up the habit so easily. He becomes so emotionally attached or maybe kind of self-reward and so difficult to cope up with the withdrawal symptoms that it becomes difficult to give up the habit on its own.
So, ma'am, you mean to say it is based on addiction level of the
Yes,
person?
yes, of course, addiction. Dopamine and the nicotine level reduces, withdrawal symptoms occurs.
Ma'am, what do you think is the need and utility of tobacco cessation services in our country?
Tobacco cessation programs are not successful in India unless cessation and counseling therapies is available people at large, right? So the treatment should focus on the physiological as well as behavioral aspects of nicotine addiction.
So, ma'am, you mean to say that tobacco cessation services are important, but what about those people who are unable to achieve or attain these services? What advice can you give for them to use at home?
So I want to give advice to those people who want to quit tobacco at home to just follow simply these 5 Ds. And what are these 5 Ds? First, D for delay. They can delay consuming tobacco, and what will happen just for few minutes also, if patient delays, this will pass on the urge to consume tobacco. They can distract themselves by moving around, talking to someone else, or make themselves indulged in doing some work so that they won't be able to or they won't feel like to have the tobacco. They can drink water. Drinking water will help to moist the oral cavity, and also it will somewhere stop the urge to take the tobacco. They can also go for the deep breathing exercises. This they have to do just for the 5 times and repeat for 5 times, and deep breathing, simply in and out breathing exercises they can do. And in the last, they can discuss with their family, friends, relatives, and most importantly their dentist.
I'm sure this will help our audience to a great extent. Ma'am, what do you think is the role of dental professionals in tobacco cessation?
Dental professionals are the one who encounter the signs of tobacco use in the early phase. It has been seen that around 30% of dental OPD coming has been involved in tobacco smoking or chewing habit. Providing chair-side counseling with the trust and confidence will give an edge to dental professionals to help these people to quit tobacco.
I'm sure people will keep that in mind while visiting a dentist. Ma'am, according to you, what can be the role of higher education institutes in this process of tobacco cessation?
We should always promote tobacco-free workplaces. It will provide you a healthy, a safer environment. For educational institutions, there are also guidelines. They should make sure to not have any kind of sale of tobacco in the premises or within the radius of 100 yards from the premises. They can also have this institutional signatures board in the premises, like in the prominent places like the building halls or maybe the entrance areas and the officiating notice boards, where so that it would be visible to each and everyone and the message will be loud and clear for everyone.
I'm sure if education institutes can follow this, it will help in a long way. Ma'am, according to you, in this age of digital technology, what is the role of technology in tobacco cessation?
We have more than 500 million mobile phone and internet users in our country. So given this fact, Ministry of Health and Family Welfare, Government of India has already initiated this mobile phone based counseling cessation program, and as well as National Tobacco Quitline services. There is a quitline service that I would like to mention here. You can note down this number too, that is 1800112356. There you will have the assistant from the counselors at from the timings 8 a.m. to 8 p.m. except on Monday, and they work from 4 places: Mumbai, Bangalore, Delhi and Guwahati.
I'm sure a lot of tobacco users might use this advice which you have given, and they will try to use this facility available. Ma'am, recently there was an amendment in the 𝐸𝐸 Act. Can you tell us what is this act and what are the amendments?
A tobacco control legislation is 𝐸𝐸, that is Cigarette and Other Tobacco Product Act. It was enacted in 2003, and recently we have got this amendment bill as a proposed draft from the Ministry, Government of India, and they have placed some regulations like the complete prohibition on advertisement and regulation on trade, commerce, production, supply and distribution. So and it has openly kept on the portal where they have asked common or general public to elicit their views or comments on that. So you can see we are already fighting, or in a place till now fighting to get these policies implemented in our country.
I just hope, ma'am, that these policies are implemented and it is beneficial for the society. Ma'am, keeping in mind the current situation, how do you think COVID-19 pandemic and tobacco usage is related?
Of course, COVID-19 has a complete impact on these smokers and known tobacco chewers as well. Smoking make people more vulnerable for this disease, as the Smoking Act itself means contacting fingers or hand to the mouth, and thereby you are increasing the possibility of transmission of virus. Furthermore, if you talk about the smoking products like water pipe and the hookah, and you are these all mouthpieces are shareable. So this how you are kind of sharing or transmitting this virus in the community settings. And if we talk about tobacco chewers or the smokeless products, it always urges to spit, and spitting in the public areas always increase our risk of transmission of virus.
I'm sure people will take opportunity during this pandemic and try to quit this habit after listening to the points which you have made, ma'am. Ma'am, last but not the least, every year there is a theme for No Tobacco Day. Ma'am, what do you have to say about the current theme for this year?
This COVID-19 has already led millions of people wanting to quit, and on which this World Health Organization has come up this year with the theme Commit to Quit, in which they are telling if you quit, you are a winner already. So they are providing all this kind of worldwide help to all the people who want to quit, and to provide them all the support which is all required.
Thank you, ma'am, for your valuable information. And ma'am, in the end, what message would you like to give to our audience?
I just want to say in the end that we as an individuals can contribute in many ways to make our society tobacco free. With the theme of this WHO this year, Commit to Quit, we all should sign the pledge. And also, let's join hands, be a change, empower others, and be a torch bearer for tobacco free nation.
I'm sure, ma'am, people will try to learn from your knowledge and will try to implement the things which you have told them. In the end, let's catch a glimpse of all the activities related to tobacco cessation which are being conducted under the aegis of SGT University.